Singapore needs a robust national mental health system that everyone can access and afford without stigma, judgement or discrimination. And that's the rallying cry from members of Parliament this session in response to a motion calling for all hands on deck to deliver on a national mental health strategy. And more than 25 MPs are slated to speak over 2 days, with political office holders also expected to weigh in tomorrow. MP Dr. Wan Rizal, who led the motion, says mental health is a matter of, quote, profound significance affecting everyone. It's become an integral part of daily life, influencing how we learn, work and interact with others.
It impacts our communities and workplaces, shaping the very heart of our nation's productivity and social harmony. From our youth grappling with stress and anxiety to adults and elderly facing conditions like depression and schizophrenia, these challenges are societal concerns that requires a collective action.
Now, the motion was filed on the back of rising mental health issues here in Singapore. MPs cited latest national data from 2022 that showed 17% of the population struggled with mental health compared to 13% in 2020. And Dr. Wan Rizal says that this comes at a cost to healthcare, but also to the nation's economy.
The economic cost of anxiety and depression is significant, amounting to $15.7 billion annually due to lost productivity and healthcare expenditure. Mental health issues have a profound impact on our social ecosystem too. They influence the dynamics of interpersonal relationship and can be a source of considerable stress, leading to burnout and social isolation. In workplaces, an employee's untreated depression can lead to decreased productivity and morale, impacting team dynamics and overall organizational health.
MPs also emphasised the need for targeted measures in various settings and for different demographics, such as students, workers and even caregivers at home. Sembawang MP Mariam Jaafar says that early intervention is needed, especially in complex cases. She recounted a case which particularly affected her, a sandwiched caregiver who lost her first son to suicide.
She had a second son who suffers from depression. She has a mother who has dementia. She worked multiple jobs to support all of them, but at no time during all the doctor and hospital visits for C, his brother or their father, her ex-husband, did anyone ask her how she, the caregiver, was coping. These stories can be hard to listen to, but they are real and they point to the scale and complexity of the challenge.
MPs also urged for better support for the elderly against the backdrop of a rising number of senior suicides. Institute of Mental Health figures show that from 2021 to 2022, there was a 60% increase in suicide rates among seniors in their 70s. And across Singapore, around 5.5% of the elderly experience depression.
The question is this: are we equipped as a society to handle these challenges? We need a more targeted approach. The senior populace is diverse. Individuals in their 60s differ significantly from those in their 70s and 80s. Our seniors are not of the same shade. Engaging seniors effectively requires recognizing differences in education, independence, employment status, and technological acumen.
Nominated MP SED Haron Al-Habshi says that Singapore needs more psychiatrists in order to better meet demand for mental health care services. A psychiatrist himself, Dr. SED Haron points out that there are about 4.4 psychiatrists for every 100,000 people in Singapore. And that is a stark contrast to countries like Norway and Switzerland, which have around 10 times more.
For sure, Mr. Speaker, the number of psychiatrists are not everything in the delivery of mental health care. However, if we were to be serious about wanting to ensure that we are adequately resourced with expertise in our midst, surely we need to look hard at these numbers and recognize how much better we can and should be in our delivery of mental health care services, especially at the specialist level of care where our patients are most vulnerable.
Dr. SED Haron says that the shortage of psychiatrists has resulted in increasingly longer waiting times for subsidised psychiatric care. He highlighted data from the Health Ministry which showed the median waiting time for a new subsidised appointment was 45 days last year. And that's much longer than the 27 days in 2018. Meanwhile, the median waiting time at the Institute of Mental Health was 29 days in 2020.